Health workers in the US state of New Jersey receiving their second and final dose of the COVID-19 vaccine developed by drug maker Pfizer. But they're very much in the minority. Not only has the rollout of vaccines been much slower than initially expected, Moderna is now discussing with authorities the possibility of halving its own vaccine doses to double the numbers immunised. A bad idea for the nation's top immunologist.
The idea about stretching it out so you can give more people, that's if you have not enough vaccine and you have a lot of people lined up waiting to get a vaccine. That's not our problem now. We have vaccine. We need to get it into people's arms.
The Food and Drug Administration gave Pfizer, then Moderna, emergency approval last month to begin administering two-dose vaccines that are supposed to be taken weeks apart. The Centers for Disease Control and Prevention said it had administered 4.2 million first doses of vaccines across the US by January the 2nd and distributed just over 13 million doses. But those numbers fall short of the Trump administration's initial claims that some 20 million people would be immunised by the end of December. Now those officials say 20 million doses had only been allocated, not administered, by the end of last month. The head of Operation Warp Speed blames individual states.
The granular knowledge at the level of granularity needed to be able to say we need to ship 1,000 doses to this CVS pharmacy or to this long-term care facility in a particular state, in a particular rural area, resides with the states.
But at least 5 US states say they received less than half the doses they were allocated by Operation Warp Speed. The UK has faced similar shortages and, along with Denmark, has already decided to delay administering a second dose of the Pfizer vaccine to immunise more people. Owen, Fairclough, CGTN, Washington.